Hello everyone. Today we're diving into a fascinating Reddit thread where doctors shared what medicine still doesn't know about the human body. Some of these things will surprise you, others might shock you. Let's begin. Doctor, we don't know what natural substance normally binds to the receptor that benzodiazepines act on. Benzodiazepines like Xanax or Valium calm people down. They attach to a very specific binding site on a group of proteins. But we have no clue what normally belongs there. Many drugs are copies of natural molecules. So this receptor must be meant for something. We just don't know what. Why not take people without anxiety, if such people even exist, and study what's in their receptors? That would be a great idea. But anxiety is hard to define, hard to measure. It's not like blood pressure with clear numbers. It's subjective and influenced by many factors. And benzodiazepines aren't even the first or best treatment for most anxiety disorders. But yes, studying people without anxiety to see if they have something others are missing, that would be a good start. One absolute fact in medicine: people born blind never develop schizophrenia. I'm an obstetrician-gynecologist. We still don't know what exactly triggers labor. We've studied the mechanics and physiology in detail. But what makes the uterus suddenly decide it's time? I'm an anesthesiologist. We still don't fully know why inhaled anesthetics like sevoflurane work. We have theories, but the truth is we don't know. And many in the field say whoever solves this will win a Nobel Prize. I'm a doctor. Here are a few things medicine doesn't understand. First, anesthesia. We know it works. We just don't know how. Second, psychiatry. We still have a very primitive understanding of mental illness. Diagnostic criteria keep changing. They're based mostly on words from the patient and subjective observations. Third, neurology. We don't fully understand how the brain works. Fourth, immunology. Don't even ask. The truth is, we barely know anything. Fifth, hiccups. We only have theories about why they happen. About 10 years ago, I had a traumatic brain injury. I fell off a horse. It flipped, and I was kicked in the head. My skull fractured. But 45 minutes later, I could stand and walk. It felt like I had the best guardian angel in the world. But something had changed. Neuropsychological tests showed no difference before and after. But inside, I felt broken. That's when I realized our brain and consciousness are purely biological. A strong hit can literally change who you are. In a way, the old me died at 19, and a new me was born that day. We also know very little about the immune system. Autoimmune diseases like multiple sclerosis and lupus are still a mystery. The body flips a switch. But why? We don't know. My autoimmune journey began after antibiotics. First, ulcerative colitis. Then, kidney inflammation. My case was even written up in a medical paper. I'm convinced the gut microbiome plays a massive role. When I had kids, my symptoms improved. I think eating from the same plates, sharing food, and even germs with them reset my microbiome. I'm a sleep specialist. We know REM sleep is important. But why do we dream? Why do dreams have stories instead of random images? Here's another mystery. How does the body tell the difference between gas and stool? It sounds funny, but it's real. We can fart in our sleep without issue. So there must be a deep mechanism. My dad always joked, The sphincter is the smartest muscle in the body because it can tell solids, liquids, and gas apart. I'm a researcher. We're studying the connection between the gut microbiome and mental health, even aging. For example, people with inflammatory bowel disease often struggle with anxiety and depression. But we don't know why. The truth is, studying diet long-term is almost impossible. People don't stick to one diet. Even if they do, it's hard to prove. Food studies are often funded by the industry itself. So bias is everywhere. One famous study, decades ago, tried to prove saturated fats were dangerous. Patients in psychiatric hospitals were put on strict diets. The results were surprising. Those who ate more saturated fats had higher cholesterol, yes, but their overall health was better. The data was hidden for years. It only resurfaced much later. So how much do we really know about food and health? Another big problem: women's bodies are understudied in medicine. Almost all data comes from research on men, often only on men. It drives me crazy. Clinical trials need to change. But most still recruit healthy males and postmenopausal women. Meanwhile, hormones shape women's health for most of their lives. Women often don't get proper medical care. The answer to many problems is, it's just anxiety, or it's depression, or simply because you're a woman. Here's an example. Viagra actually helps with menstrual cramps, but the study was stopped and the drug was never licensed for women. Meanwhile, men got their erectile dysfunction pill heavily researched. It seems male sexual pleasure was considered more important than women's pain. In human cells, there are organelles called vaults. They were discovered in 1986. They're made of 70 copies of one protein. They're 3 times bigger than ribosomes and bigger than many viruses. We still don't know their function. Probably something with the cell nucleus. But animals can survive without them. And classic lab organisms, like fruit flies and nematodes, don't even have vaults at all. A pathologist once told me the most fascinating part of his job wasn't finding out why people died. It was seeing how much could be wrong with a body, and yet people were still alive. So many deadly pathologies, and somehow they still functioned. A friend of mine died of pneumonia. He was too busy at work to take sick leave. He just kept taking over-the-counter meds to mask symptoms. When they did an autopsy, they found he also had cancer in 3 places. Yet he kept working till the end. He was a tough old man. Many drugs we don't even know how they work. Take antidepressants. Studies often show they barely work, but we all know someone whose life was saved by them. When my doctor prescribed propranolol for migraines, he said, "This is a blood pressure drug, but it also helps migraines. Nobody knows why, but it works, so we use it." And he was right. It worked. I think the bigger issue is this. Not everyone with a diagnosis actually has the same illness. Years ago, I was diagnosed with major depressive disorder. Nothing helped, no drugs, no therapy. Then, in my 40 seconds, I was diagnosed with ADHD. I started treatment, and I never had a major depressive episode again. Depression wasn't the cause. It was a symptom. We know almost nothing about fibroids, tumors that affect up to 75% of women. The biggest one ever removed weighed 45 kilograms. We have theories, but little knowledge. Surgery is basically the only option. When doctors found a fibroid in my wife, they told her it could be cancer because it was growing fast. I did my research. Turns out, Malignant transformation is extremely rare, 1 in 10,000, and almost always in women in menopause. Fast growth doesn't even mean cancer. So the doctor wasn't exactly lying, but he caused way more anxiety than necessary. During breast cancer treatment, I asked a lot of questions. The answers shocked me. Why do I need Claritin before chemo? Nurse, it helps with bone pain. Why does that happen? Nobody knows. What are these strange cords in my arm after mastectomy? Physical therapist, nobody really knows. Why did I suddenly develop gluten intolerance after cancer treatment? Gastroenterologist, we don't know. After cancer, I finally realized the human body is still a mystery. Especially gluten, that was the weirdest part. My son once had a tibial bone infection. Doctors never found the bacteria behind it. He took antibiotics for 50 days. Right after, he developed celiac disease. Autoimmune. No one else in our family had it. So, maybe chemo triggered your immune system too. Bodies are strange. I hope you beat cancer fully. Here's another mystery. How do we regain consciousness? I once lost consciousness playing football. I had a severe concussion, but I kept playing. I was tackling, giving orders all on autopilot. It was my best training ever, but I don't remember a single second of it. I watched the video later. It was me, but I have no memory. It's terrifying and fascinating what the body can do without consciousness. I recovered, but it shook me deeply. I'm a dermatologist. We don't know exactly what causes itching at the molecular level. That's why it's so hard to treat. And we still don't fully understand migraines either. It took me years to find my trigger sleeping on my back, worsening my apnea. I'd wake up at 4 a.m. with a terrible headache, then vomit every 30 minutes till the afternoon. It ruined whole days. Then 4 years ago, I got a cartilage piercing, and my migraines almost disappeared. Now, if I get one, I vomit once, sleep an hour, and it's gone. Migraines are brutal, and triggers are different for everyone. My mom's migraines stopped after menopause. My sister's stopped after pregnancy. Mine were caused by birth control pills. It took 10 years for someone to figure it out. Doctors missed it. Only a nurse suspected it. I switched pills. Migraines gone. I'm a mental health specialist. We still know very little about schizophrenia and bipolar disorder. We understand fragments, but the whole picture remains confusing. I have bipolar disorder, and I've studied every drug I take. It blows my mind how different they are. How can something as simple as lithium carbonate, a mineral, work just as well as heavy antipsychotics or anti-epileptics? Allergies are another mystery, especially food allergies. Why do adults suddenly develop them? I loved pistachios as a kid. One Christmas dinner, I ate one and my throat started closing. Scared me half to death. But antihistamines saved me. At first, I blamed hibiscus tea my sister made that night. But the next year, it happened again. This time from pistachio jello salad. That's when I knew. Infertility is another puzzle. Sometimes the official diagnosis is simply unexplained. All tests normal. In theory, the couple should be able to conceive, but they can't. And it happens far more often than people think. My husband and I were diagnosed with male factor infertility. 4 years, nothing, is less than #0. 5 is greater than, then suddenly, I got pregnant. had a miscarriage. Then immediately got pregnant again and had a healthy child. What changed? Nobody knows. And here's something strange. After IVF, many couples conceive naturally later. It's like the procedure teaches the body how to do it. I had unexplained infertility. After 3 years of trying, I had my son via IVF. 20 months later, I was pregnant again, naturally. Now I'm 31 weeks. Twins are also mysterious. We know how zygotes split, but we don't know why it happens in the first place. Even the role of genetics is debated. We also don't know what causes ADHD. Many still doubt if it's even real. But it affects 2 to 5% of people. And here's something dark. People with ADHD are far more likely to die young by suicide or violence. It's grim, but true. There's one brain region called the claustrum. Some believe it holds the key to consciousness itself. In ADHD, the claustrum is hyperactive. Suppress it in rats and they act bizarre, chaotic. If we truly understand it one day, maybe ADHD will be seen not as bad behavior, but as something closer to epilepsy. That shift in thinking could save countless lives. I'm a trauma surgeon in training. We study why some patients survive injuries while others don't. 2 people, same age, same wounds. One recovers. The other dies. Why? We don't know. Even in intensive care, we mostly provide supportive treatment. We don't know enough to prevent or stop the chain reaction of trauma or sepsis. We're always catching up, never ahead. We don't even fully understand why severe injuries trigger systemic reactions while smaller ones stay local. If we could map that, we might learn how to help the body recover faster. And think about this. Even for the most common diseases, causes are unclear. We don't know what exactly causes type 1 diabetes. We don't know the root cause of asthma, or why some premature babies develop lung disease while others don't. Here's one rare condition I've seen: laryngeal chemorflex. Infants suddenly stop breathing, turn blue, terrifying parents. Usually linked to reflux. But kids outgrow it. It's thought to be hypersensitive throat nerves. Again, not fully understood. Eczema is another riddle. We know some molecules and genes involved, but the bigger picture remains a puzzle. I'm a speech therapist. We don't know exactly why people stutter. Sometimes it's genetic. Sometimes it appears in childhood and vanishes on its own. But treatment is tough. My father is a doctor. He once said, "Nobody knows why some heavy drinkers never get cirrhosis while others get it after just a year or 2. I'm a physiotherapist. The biomechanics of the wrist are still unclear. Heel pain, also a mystery. And frozen shoulder often appears with no cause at all. We don't know the origin of the vestibular system. And we don't know why people age. Dogs live about 10 years. Humans about 80. It's partly linked to telomeres. But beyond that, we don't know. And finally, the placebo effect. People get better from fake drugs simply because they believe. Even stranger, the nocebo effect. People get worse just because they expect to. The brain clearly has hidden powers of healing, but we don't understand them yet. Thank you for watching. Maybe you have your own examples of mysteries medicine still hasn't solved. Share them in the comments. And don't forget to check out our previous videos. Make sure to subscribe. And good luck.